in nursing, there are many different types of advocacy. Two of the most common ones that you would come across are patient advocacy and advocating for safety. So if we were to look at patient advocacy, an example of this would be you were working on a medical ward. One of the patients who you've been allocated that day was flagged for discharge by the medical team. And you notice that throughout the shift, they're becoming more confused, they're not as independent with their ADLs as they normally are, they're not eating and drinking, and you're just generally quite concerned about them and their ability to safely take care of themselves if they were to go home. So in this situation, as the graduate registered nurse, you would need to go and speak to the nursing team leader in charge of the shift and raise your concerns with them, and also go and speak to the treating medical team and raise your concerns that you feel that patient isn't safe for discharge. Ultimately, the outcome of that scenario would be that the patient would remain an inpatient in hospital, that they would receive some more investigations, potentially some more allied health input, so some physiotherapy or occupational therapy input, and that they would be treated as an inpatient until they are safe to go home ultimately. In regards to advocating for safety, so an example of this again would be you as a graduate registered nurse are going to administer an IV antibiotic. You ask your buddy nurse, your senior RN, to check the medication for you, and they check it, they're happy with it, and then you head to the patient's bedside to administer, and they do not come with you. So in that instance, as with all high-risk medications, you need two nurses to come to the bedside to administer so that you can check your 7 rights of medication administration, and that is the right drug for the right patient. The senior RN who you ask to check the drug should come to the bedside with you, basically. So in that situation, you would need to speak up and say, hey, I know you're really busy, but I need you to come to the bedside with me so that we can safely administer this medication as per policy and procedure. The outcome for that situation would hopefully be that the RN would come to the bedside with you and that you could safely administer that medication as per guidelines and policy. So as you can see, advocating is a really important part of a nurse's job, not only for patients but for staff safety as well.